they're not going to set a quit date, go and start the drug. I'd do something else. Okay, those are the medications for smoking cessation. Any comments or questions? Okay. Let's look at selecting therapy. So, what to choose? My approach was always, here is what it is. I would look at, did they have any contraindications? Then I wouldn't even mention those. But I would tell them, here is what we know. We need you to, if you want a drug, and a lot of them are already aware, they've used them before, and so they'll tell you often, here's what I want. If you've got first-time quitters, then looking at all the different options would be something you may want to walk through them. Ask them about their previous experience. If they don't like a patch and they're never going to use a patch, then don't prescribe a patch. So talk to them about what they've done in the past. Sometimes, the only one I get a little bit, I spend more time is with the gum, because a lot of people don't use the gum appropriately. And so it may be that it didn't work because you didn't use it correctly. But you got a lozenge as an option instead. Insurance consideration costs. So what will be covered? There is one other agent, and a lot of the antidepressants have been looked at this in terms of smoking cessation. Nortriptyline is a very old, it's a first generation, been around 50 years. It is a drug that has been used for smoking cessation. It's very cheap. It's got a lot of side effects, and that's why those first generation tricyclic antidepressants have a lot of anticholinergic side effects, and they do have some cardiovascular effects as well, and so people tend to not use them as often because of that. But that is an option for some people if they can't use anything else. In terms of combining therapy, you can combine a long-acting with a short-acting. We talked about that. So a patch with one of the, like the gum or the lozenge, would not do nicotine spray in a patch. It's too much. Bupropion and nicotine patch is reasonable, as well as Chantix in a patch. So the patch, though, in those cases where you're starting before a quit date, I would not start the patch until they've stopped. All right, let's look at e-cigarettes. So what do you know about them?
They cause popcorn lung.
They cause popcorn lung. You want to say more about that?
So when people would work in like the popcorn factories, they get this accumulation in their lungs. That's it's like the melted butter would like get into our lungs, and it's bad.
Okay.
So it was like the vaporized butter. They breathed it in, and it would like kill their lungs.
Interesting. Okay. What else?
It's not regulated, right?
It is regulated as of 2016. It wasn't up until that time. Yes. So it had fairly. Anybody could walk into a e-cigarette place, vaping place, and buy it. What else?
People put illegal drugs in them.
Oh, they sure do.
I don't have like a label, like what all is listed in the document.
That's true, except I think they do have to do that now, since the FDA took them over. But before that, you're right. There are additives that are probably carcinogenic, but we just haven't had people using them long enough.
Do the liquids taste like they smell? Because they're always like fruity smelling
Yes.
flavors.
Yeah, there's like 700 flavors.
And you can pick your nicotine level.
You can pick your nicotine level, that's true.
They just let people choose.
Well, no, they come packaged, so like some have like 5, the other one's like 2.5, the other one is
You buy
1,
the string.
and then there's 0.
So there's a picture on this page. What page is that? 15. So it shows you the parts. So it's battery operated. It is, you have ability to heat the liquid, contains the nicotine that vaporizes it, and then there's the inhaler. So these were originally marketed by small companies to the consumer. The bigger companies now have taken them over. So mostly the cigarette companies own these companies now. So there's different forms if you haven't ever seen one. All you have to do is sit at a stop sign or stoplight and look around, and about half the people seem to be vaping. Main component is the nicotine, but a lot of them contain propylene glycol or glycerol as humectants. Keeps it in, keeps it from evaporating as much, and also keeps it more stable. Flavorings. The nicotine content of e-cigarettes varies. It can go anywhere from 6 milligrams per mil up to 36.
So even if you get one that has 0 nicotine, it's still bad for you? Or?
So you can get nicotine free, but if you look down further, because of that, they weren't highly regulated, they found that even those still had nicotine in them. So a problem. Metals, tin, lead, nickel, chromium have been found in e-cigarettes. Nitrosamines, carbonyl compounds, metals, volatile organic compounds, phenolic compounds. So I'm sure we're going to see more of this as time goes by. So prevalence, so about 12%, 12 to 13% of adults report it. If you look on that second bullet, the increase went from 1.5 to 13.4% in high school students in a 3-year period. Middle school. So when I was at the VA, I would ask men, when did you start smoking? A lot of them would tell me 5 or 6. I'm like, are you kidding me? So their older siblings would teach them how to smoke. You know, they rolled. My grandfather rolled his own. He showed me how I could roll a cigarette. He bought the tobacco in a tin, and he had the little papers. He'd roll it up and lick it to seal it, and there you go. So the safety and efficacy is unknown. The FDA did take over the regulation of these in 2016. So one of the first things was kids under 18 could no longer purchase them. They could walk into a store and do that anymore. It also regulated, the FDA can regulate vending machines. So used to, every place you went into, there was a vending machine with cigarettes. Now you usually only see them like in bars where people 21 and older or 18 and older can go. Giving free samples of them is no longer allowed since the FDA. The FDA is requiring them to submit an application to demonstrate that their products meet standards. So we'll see probably some of these things go away. And if it says it's nicotine-free, it'll be nicotine-free. Some states have banned e-cigarettes wherever regular cigarettes, like you can't use them on an airplane. I've also seen movie theaters that shoot. You look around it, you got lots of people using them in the movies. So what do you do if your patients are going to choose those? I think somewhere in there I have put down that you need to cover all the options with them. You need to also cover the unknown risk with e-cigarettes. But in the end, the recommendations don't come out and say don't use them because they may be a better option than smoking a cigarette. Yeah.
Have you heard of the electronic devices having an explosive issue?
No.
Yeah, they're blowing up in 2009.
Really?
Batteries, yeah, they're.
The batteries, are they lithium
I
batteries?
think so, they're overheating.
Wow. Did you see that thing? I saw it on the news. It's probably on YouTube. That computer that caught fire in a guy's. He got a warning alarm from his company, and they went back and got the video. He had left his computer plugged in. Had an lithium battery in it, and it exploded in his office at night. Because they overheat, I guess. Yes, as I'm looking at your computer. At least I'm close to the door, I can. If y'all start exploding, I can.
Do you get any kind of secondhand exposure from the e-cigs? Like, I mean, with the VOCs or phenols or anything
Yeah,
like that?
I have not looked, but I haven't also seen it come up in what I've read.
Okay.
I don't know, have you seen anything?
It's a big debate now, because
It
they used
is.
to let everyone
Say what?
vape everywhere.
Yeah,
And now they're finding that like there may
That's
be
still-
risks,
Okay.
like you may have the same risks as
Yeah,
smoking, just not the
wow.
same chemicals. So.
Okay.
I think they're still looking into
And that smoke is like a
Yeah.
lot, the smoke's a lot different. It's like when I see people that vape, they smoke, they're huge.
they are huge, yeah.
For Zyban, do you have to eliminate any kind of antidepressant that you are currently on orally?
Yeah, you don't want to use two. So that would probably take some manipulation.
Because usually you have to take like, you have to stop antidepressants, so would it take
You can stop most of them. You can't stop the benzodiazepines, the anti-anxiety, the anxiolytics, you can't. Like Xanax, you would take or that one.
So you just take it off?
Okay, special populations. So light smokers. So people who are considered light smokers are less than 10 cigarettes a day. Above that, heavy smoker. We don't have anybody in the middle. So for those folks, what works best? There really isn't as much data on them in terms of using a nicotine replacement product or the Chantix or the Zyban. It may be that they need lower doses, like this here is you start with a lower dose. They're not used to that much nicotine, so using a lower dose like on the patch instead. Pregnancy and breastfeeding, some of you asked me about that during the break. They're category C, which means that there's not a lot of data in human subjects, and those categories look at teratogenic potential, or in breastfeeding transfer to the infant. So it's a real conundrum because you don't want them to smoke, and yet it's difficult. We know that smoking cessation is difficult. So it's kind of like a judgment. If they are going to quit, and the only way they can quit is to use a nicotine replacement product, then that's considered where the benefit is going to outweigh the risk. No data on Chantix. Bupropion seems to be have a higher risk with miscarriage and congenital anomalies in the first trimester. So avoiding it during that 3 months would be wise. So, psychiatric illness, if you deal with patients who have psychiatric illness, you will find a lot of them smoke. It will be a higher percent than you would see in the regular population. No known problems with using the nicotine replacement products. As I told you, the Chantix and the Zyban, their restrictions in psychiatric illnesses have been lifted. However, because you're dealing with a psychiatric disease and you're using a more psychotropic drug, you need to be careful. Warn the patients, warn those who live with them about changes that could occur and that it may be drug effect and not underlying illness effect. For people who use smokeless tobacco, there is no data on using these products with them. So there would be your better judgment. The nicotine replacement, overall, if you've got a stable patient with stable cardiac disease, there doesn't seem to be any increased risk in using any of these products. Then in your unstable, you need to be more careful. Of course, if they're smoking and they're trying to quit, that's different situation. You may want to switch them over. A lot of the data goes with the patches as opposed to the shorter acting ones that we talked about. Bupropion seems to be stable, in stable cardiovascular disease to be safe. The vareniclins or Chantix, that one carries an increased risk of angina or worsening chest pain. So again, being careful. What about the adolescent or pediatric population? Again, it's recommended that they undergo behavioral therapy as well. Nicotine patch or gum has been shown to be effective and safe in adolescents. They are required, though, to have a prescription if they're going to purchase over-the-counter nicotine replacement products. Patients concerned with weight gain. I think I talked about this in nutrition. It is real. A lot of patients, I've had women who they would rather smoke than gain the weight. And the men didn't seem to care, but for addressing their concern is real. 10 to 30 pounds is very common. So talking to them about what to do. Food's going to taste better, food's going to smell better to them. Their appetite is going to go up because they don't have so much dopamine flooding their system. So talking to them about that approach and smoking cessation preparation, it would be important to address that if it is a real concern to them and puts them at risk for not staying with that plan. Hospitalized patients, most all hospitals I know of are smoke-free. So usually there is a plan within the system of how to address smokers. The patch has been used quite a bit in that population if nicotine replacement is needed. The last 2 pages of the handout are a table of the products and the information that covered today. Questions? All right. I may or may not see you this afternoon to talk about influenza, pneumonia. We cut that out of last week. I think Kevin Kincaid is coming to talk to you about influenza. I think he's got a couple other things. If he finishes early, then I may slip in and do a little bit on that before you see Professor Waddington. All right. If not, I'll see you on Thursday with you.